Good evening, everyone. I'm Luciano Nardo. I'm a consultant gynecologist and fertility specialist in the United Kingdom, and I am the CEO and founder of NOW-fertility. Today's webinar will be on the use of assisted conception treatment for sex selection. I'm honored and pleased to have my colleague, Dr. Mazen Bishara, who is the medical director of the IVF clinic at Health Plus in Jeddah, joining me today. Mazen, good afternoon.
Good afternoon. It's a pleasure for me to be with you on this webinar, and nice now talking to you.
Today's webinar will address the topic of the use of assisted conception for sex selection for medical and non-medical reasons. And we are aware that the Ethics Committee of the American Society for Reproductive Medicine has recently published a practice document in order to provide fertility physicians worldwide with an opinion and to some extent a degree of guidance. So the first question I have for you, Mazen, is could you please tell me what are the common indications, medical indications for sex selection?
Well, usually we have some patient, they come to us asking for gender selection. As you know, like it's a very popular thing that they might ask for. To be honest, most of the patient, when they come to ask us, their actually reason is like family balancing. Which I would say it's not really a medical reason. We go through the whole procedure. We try to explain to them the pros and cons, disadvantages and disadvantages, and how we can do the procedure. As you know, that there is multiple, or I would say like not only one way, more than one way to help the patient with gender selection. And we always tell them that there is a percentage of success. There are two kind of percentage that I usually discuss with the patient. One of them is whether the patient, she will get pregnant to begin with after we do one of the assisted reproductive technology aiming towards a specific gender like artificial insemination, or what we call IVF with PGTA, where we make like a study for the chromosomes for the embryo. So the patient, they should understand fully always, and they should go through an informed consent, and they know as I say, the advantage and disadvantage of the whole procedure. Yeah.
Do you offer counseling to these patients the same as you would be offering to patients requiring sex selection for medical reasons?
Yes, actually, they should like get an appropriate and full counseling, I would say, from the beginning, as we tell them that we have to explain to them how the procedure is being done, whether it is like an artificial insemination, or if we are going one step further, like doing what's called PGTA. The patient, she should understand that she will need like medical treatment. She has to go through a bunch of blood tests. We have to assist the patient. Of course, we have to take a full history, taking in mind the age of the woman, her ovarian reserve, how many eggs will be collected, assuming that what would be her ovarian reserve if we start with her, or the ovulation induction protocol. So they should actually like take a full consultation. They should be counseled thoroughly through the whole process about the risk and benefit, the chance of success, how the procedure is being done. So they have to get a full consultation regarding this if they are asking for a non-medical gender selection.
There are arguments to support the use of assisted conception for sex selection, and there are arguments against the use of assisted conception for sex selection. And one of the arguments that perhaps will be used by some would be what happens to the embryos that are left after genetic testing and are of the sex that is not the one chosen by the parents. So what do you tell your patients, and what is your current policy and procedure at Health Plus?
Usually, patient they are informed from the beginning, as we said, when they go through the full consultation regarding the non-medical, gender selection for, let's say, family balancing, as we say, they should know that if there is an extra embryos that they will not be utilizing. They have the choice. The patient, they have always the choice if they want to freeze these embryos for a possible future use, or if they want to discard them. So, and nothing can be done, of course, without the consent patient. So the patient is the one who should decide. Of course, the couple, the wife and the husband, they are the one who should decide about the fate of the embryos, whether they want to freeze them or they want to discard them.
Okay, thank you. And do you think that there is a possibility of using the supernumerary embryos that are not of the sex selected by the parents for research and training purposes in the future?
Well, that's a possibility, I think, but of course, they have to give their consent. The patient, we do PGT-M for anomalies, and that sometimes also give us an indication, or we would be able to know about for some of the embryos. But I'll go back again to your question. I would say that yes, we can actually we can have them involved in a research, but this actually need to have we need to get the consent of the patient, of course, husband and wife.
Thank you. And in your experience as a fertility physician, do you think that patients appreciate the risks of IVF and when they embark on assisted conception for sex selection?
Usually, yes, they actually appreciate all the procedure, I would say, taking in mind they have everything explained to them fully from the beginning, like the way how we do the procedure and the time limit also. Of course, the cost is something very important to the patient, so they have to know before we start how we do the procedure, what would it involve if we are doing like an IVF, regular IVF, or IVF for gender selection, as we said, for non-medical reasons. So they usually appreciate the result as long as everything was explained to them fully from the beginning, because it's not really guaranteed. The pregnancy you can do. Each one of us as a physician, we can do everything, and at the end, the patient, she does not get pregnant, or maybe they have a desire toward a specific gender, and then they will end up without this gender. There's somebody who wants to have a boy, and down the road, when they do the testing and the chromosomal analysis of the embryos, we don't have a boy at the end. So the patient, as long as they understand that this is a possibility, then they will appreciate and they will agree to what we will tell them at the end, and they will accept the fact.
As a fertility physician, what advice would you give to patients who come to see you for sex selection for non-medical reasons in terms of the time between a consultation and the time to make that decision? Because it's an important decision. And I know for certain that you want to do the best for your patient, but you also want to be sure that the decision they made is one they've made without pressure. They've made themselves, and they're aware of the risks and burdens of the procedure. So is there a time that you ask them to wait, to reflect, to think about?
Of course, actually, I think any one of us as a physician, once we see a patient who's coming for a non-medical gender selection consultation, I think we have to be neutral. We have to be neutral in a way that we tell the patient the fact from the beginning, as we said, like a full consultation. Everything has to be explained to the patient. We have to be neutral, and we have to tell the patient that they have to think about it, because it has actually, as we say, advantages and disadvantages. Of course, the patient, they have their reproductive liberty and their patient autonomy. All of this can be taken in mind on our behalf. But again, the burden from the procedure, the burden, whatever it is, whether it is physical or it's a cost-wise, the patient, they have to understand it. They have to know, as we say, that all the risk and all the benefit and all the chances to have what they come from or what they came from for. We have to be neutral. This is what I would say, and we have to tell the patient and advise them about the possibilities. But usually, my position in response to gender selection for non-medical reason is very neutral, I would say.
Okay, thank you. I think there is a general consensus, and this was also well expressed in the ISLM document, that the practice remains to some extent ethically controversial, and all clinics are encouraged to draft and make available some policies and procedures. Do you have any specific policies and procedures within your clinic that will help patients undergoing assisted conception for non-medical sex selection?
Yes, actually, we do for patient who comes for non-medical reason for gender selection, policies and procedure that we have to follow, indicating, of course, the agreement between the clinic and the patient. They should understand all the IVF procedure that we explain to them. So usually, as we have a policy and procedure for all patients who are undergoing regular IVF or artificial insemination or any sort of the assisted reproductive technology method, we do have policies and procedure regarding the gender selection. Yeah.
Okay, thank you very much. So I would like to thank you for contributing to this webinar, and I sincerely hope that our listeners will enjoy the information that you have provided, and will help them to make an informed decision. Thank you very much.
Very much, my dear. It was really nice talking to you, and I hope that this is beneficial for the audience. Thank you very much.